Hi guys, welcome again. Let's talk about why your vagina itch. Most people consider itching down there to be yeast infection. It can be yeast infection, it may not be yeast infection. Most commonly known yeast infection down there is candidiasis. There are other reasons that may make your vagina itch. Itching around there is usually embarrassing, not just embarrassing, irritating, and sometimes they are associated with thick vaginal discharge. I have said that the type of vaginal discharge you have, the smell of the vaginal discharge actually describes what the disease you have down there. Itching there can be embarrassing. Imagine you are walking on the way and you are scratching. Oh my God. It can be embarrassing. Sometimes, if you're in the presence of people, you have to start dancing or doing some movement to show that, so that you don't embarrass yourself so much. However, there are other causes of itching in your vagina, and we're going to find out through this video. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazayo. Please subscribe to my page and make up your mind to share this video. I discuss everything about women's health, children's health, and sometimes men's health on my page. So subscribe, share this video, follow me on Facebook, TikTok, Instagram, and YouTube at OBGYN Talks with Dr. Adazayo. So let's go on with why your vagina itch, why you actually itch down there. Noticing this itch, you may automatically assume it's a yeast infection and you may reach out for antifungal treatment. However, there are several causes to vaginal itching, and each of these causes should be treated differently. If not, you will get a fungal treatment for a non-fungal cause, and despite your treatment, the problem continues. So what are the common causes of itching down there? The commonest cause for vaginal itching is yeast infection. Commonly known, the commonest is candidiasis. And how do you know it's candidiasis? The itching is intense, burning, and sometimes is associated with cordy, thick-like vaginal discharge. This itching is so embarrassing that as you are itching, it is very painful. And despite that it's very painful, it is also sweet. So sweet like itching, sweet painful itching. I don't even know how to call it. Sweet painful itching. So the more you itch, you notice that you are injuring yourself the more. Initially it will be sweet. The next thing, it is very burning sensation. That is how you know you have vaginal candidiasis. I will tell you what to do about it. The second cause of vaginal itching is sexually transmitted infection. Most people will come to the hospital and say, I have infection. They're going to tell their doctors, I have infection. Not all of them is infection. And I assume that when you are telling that you have infection, you mean sexually transmitted infection. Anyway, in sexually transmitted infection, the itching is intense too. It's burning. The discharge that comes with it are sometimes malodorous. You have some of the discharge is odorous. It does not smell fine. Vaginal discharge has its own kind of odor that is non-irritating, that is not bad. But the one of sexually transmitted infection is sometimes malodorous, and the color may be yellowish, pus-like, or even greenish. If you see any discharge that is yellowish or looks like pus and is smelling, or greenish, it is sexually transmitted infection. And sometimes you will not see that even the itching has developed to ulcers, to blisters around your vulva or vagina. You will not have pains around that place, even when you are not itching. That's sexually transmitted infection itching. And the commonest include trichomoniasis. The itching with trichomoniasis, oh man, you will itch and itch and itch. The one, it can also be from herpes simplex virus. These are, or even genital warts, from warts. You may notice some growth-like, not blisters now, some growth-like things on your vulva. That's genital warts, and you can get that from human papilloma virus. This can give you itching. So not all itches in your vagina is candidiasis. Not all of them is yeast. Now, we have skin reactions or allergy. The way the other parts of your body react to irritants or having, when you say, I have allergy to this or to that, that's the same way your vagina can have allergy. If you change fabrics, we actually tell everybody to use cotton on this. Let's assume you now use nylon on this and you have some allergic reaction to that nylon. You can actually have irritation down there. Or it's not advisable to use scented pads. It's not advisable to use scented tissues. They are not good for that place. Do not douche. You carry your hand, carry soap, carry sponge, you put your hand inside your vagina and be scrubbing. Are you trying to wash away your sins? Please do not douche. All those things can cause reactions, they can cause allergy. If you change bathing soap, not the one you used to use before, your body may react to it. So as your body reacts to normal allergic things that it's allergic to, that's the way your vagina can react to things, and it will give you terrible vaginal itching. So if you start itching and you found out that either you changed a fabrics, your undies, or you changed a soap, or you used scented tampons, scented pad, they are not good ideas. Please stop and do not douche. Do not use scented soaps around there. Please, it's not advisable. So that can cause you terrible vaginal itching, and you may worry, so embarrassing, irritating, and you won't want your hand to always be there because you want to be scratching, except if you don't want to come out of your house. So the next thing we're going to talk about is jock itch. When we talk about jock itch, it's also known as tinea curis. This I know if you check, just go to a mirror, open your legs and check. If you have any patchy white area around your vulva or your thigh, know that you have this jock itch. Most time it itches, and it's a fungal infection that develops in moist areas. That's why you need to keep this your down below clean and dry. If you change an undies for any reason, please do not wear it back. Do I even say change? If you remove your undies for any reason, do not wear it back. If you remove your undies because you want to go to the other room, do not put that undies back. When you finish the other room activities, don't put it back. If you remove your undies that because you want to bath, do not put it back, please, because the undies absorbs vaginal discharge. And when those vaginal discharge have been exposed to air, they may be exposed to some organisms that may go back and start affecting you. So for no reason will you remove an undies without washing it and you put it back. As you remove, please wash it before you wear it back again. Now, jock itch, it happens around the vulva, around the thigh, inner part of your thigh, close to your vulva. They don't enter the vagina. This jock itch, it does not enter the vagina. So you see it as a whitey patchy area, and it's scratching, is irritating. It happens mostly in places that are moist. So if you keep that place, it's not erected, and you are wearing nylon pants, you are wearing dirty pants, moist pants, you go to ease yourself and you do not clean up, you may have this jock itch. This jock itch most times are associated with redness, itching, irritation just around the thigh, as I've said, and most times it doesn't go away. So you have to be very conscious about it. That's how to help that one. In that moist area, that's why it developed. Then another cause of vaginal itch is lack of estrogen. If someone is menopause, as in someone is already in menopause, like older women, younger girls, you notice that most times they will tend to itch, not because there's something wrong, it's because of lack of estrogen. So it thins the vagina, and the vagina, it thins labia minora, labia majora, it thins it doesn't, there's no enough fat, and the person tends to itch. It makes it dry as well, and so with dryness sometimes the person will tend to itch around that. You see this in people that attend menopause, see it in people that are breastfeeding. That's about estrogen. Now, hemorrhoid. Hemorrhoid can cause vaginal itching. Hemorrhoid happens in the anus. It happens because of we call it pie. The common people call it pie. Hemorrhoid happens in the rectum. It's as a result of swollen or dilated veins in the rectum, and most sometimes that's associated with itching. That itching can spread to the vagina, and so because the anus is closer to the vagina, so it's possible that it can spread. Now, I want to make a very important point here. Please, not about hemorrhoid now. If you're a lady and you are going to clean and you want to use tissue paper to clean after going to the toilet, please clean from front to back. Teach your baby girls to clean from front to back, not from back to front. Front to back, so that you don't carry the organisms from the anus to the vagina. Then another thing is you have to we have contact dermatitis or folliculitis. You know, we have hairs around the vulva. If there is anything that causes inflammation of any of the hair follicles, it can lead to scratching, it can lead to pain, it can lead to itching, and so that's another cause. So if you go through all the things I've mentioned and you did not see any reason, it may be because you have folliculitis in that place. Bacterial vaginosis is another infection in that place that can lead to vaginal itching. Bacterial vaginosis is a conglomerate of bacteria. They come together and form this organism. I'm putting it in a layman's term as much as possible, and it has this characteristic vaginal discharge that is fishy smelling. Smells like fish. So if you have anything coming out from your vagina that smells like fish, the diagnosis, even without test, is bacterial vaginosis. So that's about bacterial vaginosis. It can also lead to itching associated with smelling like vaginal discharge. Now, vaginal itching, is it normal? Is it abnormal? If you have occasional itching, it's normal. It's not persistent. But if you ever have anything that is persistent, you should be thinking about it being an abnormal itching. Now, when do you see your doctor? If you have ulcers or blisters around your vulva, please see your doctor. If you have pain or bruises or redness in your vagina, please see your doctor. If you have pain while urinating or discomfort while urinating, or you have any redness or ulcers around your inner thigh or close to your vulva, or you have discomfort during sexual intercourse, please see your doctor. Your doctor, especially your gynecologist, will know what to do. If you don't have anyone to see, you can come to my DM. We do online consultation. Now, how do you prevent or avoid itching? Let's keep it at a minimum level. Minimum itching. These are the things to do. These are few methods to keep itching at the minimum down there. Now, use only unscented soaps. Use only unscented lotions where around your vulva. I'm not talking about inside your vagina. Do not use scented tampons. Do not use scented fabrics. Do not use scented sanitary pad. They are not healthy. If you go to the bathroom, please wash from front to back. Clean from front to back. Now, change every wet on this. Whether you finish swimming, you finished intercourse, or for any reason your undies becomes wet, change it immediately. Do not use vaginal spray. That place has its own peculiar odor. Don't go and make it to be smelling like one kind perfume. It's not necessary. Who will like you go like you. So please, do not use vaginal spray. Change your undies daily. Change your pants daily. Keep your vulva area clean and dry. Thank you for watching to this point. See, this thing wants to write me. Thank you for watching to this point. My name is Dr. Nkiruka Bridget Atobi Njawa. Talks with Dr. Adazoyon. I discuss everything about women's health, children's health, and sometimes men's health on my page. Please share this video right now Look out for our next video. God bless you. Thank you for watching. See you guys next time.